So, ladies and gentlemen, welcome to this press conference, this daily briefing for the COVID-19 crisis. Today it is the Deputy Premier of Quebec and the Minister of Public Safety, Madame Geneviève Guilbault, who will be presiding this press conference, together with Ms. Danielle McCann, the Minister of Health and Social Services, and Dr. Horacio Arruda, the National Director of Public Health of Quebec. Ms. Guilbault. Thank you very much. Hello, everyone. So before going over to the days of the numbers of the day, I'd like to, generally speaking, talk about the many emergency measures and guidelines that we've set up in the past few weeks in order to fight against this pandemic. I wish to remind everyone that we're very conscious of the fact that things are difficult right now for a lot of people. Respecting the application of these emergency measures of public health that we have set up. However, do remember that right now we are trying to do everything that must be done to save lives. Please always keep in mind that right now we have the one objective, and that is to save lives. Not only in Quebec are we one of the places where we test the most, but we are also one of the best in the respect of social distancing rules. And those are two key elements in order to be able to win this fight that we are waging against COVID-19 right now. So we cannot loosen our efforts or ease them. Even when it's difficult, do remember that we're doing exactly what we need to do and that we will get to this objective of putting an end to this virus. So the numbers of the day. Today we unfortunately have 14 new deaths for a total of 75 deaths. I wish to offer in the name of our entire government my condolences to all the loved ones and family members of those people who have died. Today we have 6,997 confirmed cases, an increase of 896 as of compared to yesterday. 478 people who are hospitalized, an increase of 49. We have 130 people in ICU, which is an increase of 8. Today, we have numbers that are pretty encouraging as far as hospitalizations are concerned when we look at the ratio compared to the number of cases. So from that point of view, it is encouraging, but it's always very difficult to hear these statistics on a daily basis because behind those numbers are people who are suffering, families who are worried. So it is difficult to be able to talk about these numbers on a daily basis. We also have our guardian angels who are in the front lines, there to care for us and care for those who are ill. So the best that we can do for those guardian angels and for everyone is to make sure that everyone, absolutely everyone, respects the guidelines for public safety. And I would like to remind you that these guidelines are like laws, and we have police forces deployed over the entire Quebec territory to have them applied. It is not the time right now to be selfish. It is not the time to think only about yourself. It is not time to want to defy these laws. It is time to respect them. And I said so. We have the police forces that are present everywhere because we can no longer accept at this stage. We haven't been able to accept it since the beginning, but even less so now with the number of increasing cases and the number of increasing deaths. We can no longer accept that individuals, isolated groups of people continue undermining the collective efforts of everyone. And our police officers, just like our guardian angels in our health sector, are there on a daily basis to ensure everyone's task. So please ease their task. We don't want to see any more gatherings, whether they are inside or outside. We no longer want to see any non-essential businesses and services that continue functioning. So if you are a witness to these situations, these infractions to the guidelines of public health, denounce them, call them out to the police officers. I've said it before, we don't want to have a climate of over-suspicion. We don't want to get into collective paranoia, but we must remain vigilant and ensure that nobody deliberately puts in danger the lives of other people. I also wish to ask Quebecers to be respectful towards our police officers by being honest about the fact that they can present symptoms of COVID-19. So if you have symptoms of COVID-19, and of course if you've had a positive test, so if you are in fact contaminated by the virus, be honest, say so to the police officers before there is any interaction. And the same thing, of course, for our healthcare staff. If you have symptoms, be honest about it. There is no reason to feel shame. about having these symptoms. On the contrary, what would be shameful is to wish to hide it or dissimulate it and to endanger the safety and health of people, amongst others, the police and the healthcare sector. So please be honest. Please, I'm calling out to your sense of responsibility and civility on this transparency. Do not conceal anything about your own state. The other thing that is critical is everything about banning non-essential travel between regions, between cities. You know that we already have decreed, or at the very least, fixed certain territories, certain places in Quebec where non-essential displacements are forbidden. We want to avoid the contagion of the virus from one area to another. We want to avoid the spread, and we want to protect our vulnerable communities. And today I'm announcing 2 new territories where these non-essential travel is banned. I am announcing now Charlevoix, as well as the city of Rouyn-Noranda. So as of 4 p.m., we will be adding roadblocks at those places to limit the moving around these areas. The objective being, of course, to reinforce the application of the public health guidelines while avoiding any non-essential traveling or moving around. So this is to be added to the list that is already public and has been in effect for the past week. I'd like to add a word on the floods. Well, I'm the one who's here today, so perhaps just to give you an idea of the situation of the floods, you know that each spring it is a challenge managing the floods. So just simply to reassure everybody that for the time being everything is under control, the very vast majority of waterways is under control for the time being. There have been a few incidents in Beauce. There were some preventing evacuation, some minor flooding as well, but everything is going very well. I also went around to make sure that all municipalities were aware of the rules to be respected this year, amongst them the management of volunteers, services to everybody. We have to avoid gatherings, so everybody's very conscious of that, and I wish to thank all the municipalities and all the region. We are collaborating very closely with them, and if we have to intervene, we will be ready. And I want to also send a message to all citizens that here, as in other cases, we have to respect the guidelines of public health. And I saw earlier on a tweet from the Sûreté du Québec that was talking about a gathering along the Chaudière River. In floods, as in every other case, avoid gathering, whether it's out of curiosity to go see the waterways that are under surveillance or to go see the flood. So avoid getting a big group together, even out of curiosity. I am going to have thanks that are rather particular today for the daily thanks. Thanks even that I would qualify as being cute, because today I want to thank our children. We often talk about the fact that it can be difficult for parents to be at home, to try working from home while taking care of the children. But it's also difficult for our children because their lives have also been completely changed. They can't see their friends, their school, daycare. They can't always go play outside. So I wish to thank our children for showing solidarity with their parents. Continue being strong, continue smiling, continue helping us out. And we will get through this, all of us together. So I will end with the 3 guidelines that we wish to keep reminding you of. We keep repeating them because some people still don't follow them or perhaps don't know them. So the first one that is very important, avoid leaving your home unless you don't have an essential reason to do so. If you must leave your house, make sure to stay 2 meters away from anybody else. And at all times, in particular when you arrive back home after having been outside, you must wash your hands with soap. That is very, very important. So I wish to once again thank all Quebecers because despite these reminders that we make of the guidelines for the few recalcitrants that still exist, the vast majority of people are following the guidelines for weeks now. We know it's difficult. So I wish to thank you, and especially do remember that we're all in this fight together, and it is only through being unified and in solidarity, all looking towards the same objective of saving lives, that we'll get through it. Thank you. Do you wish to say a word in English? Yes.
So good afternoon. All our efforts to fight the virus are making a real difference. They are saving lives. But to win this battle, everybody must follow the instructions. Gatherings must stop and non-essential businesses must close. The police will intervene to enforce those directives if necessary. Another crucial element is the ban of non-essential travel between regions. This is why we are announcing the establishment of police checkpoints to restrict movements in 2 new territories, Charlevoix and the city of Rouyn-Noranda. It will help us prevent the virus from spreading from one region to another. I also want to say a word about the flooding situation this year. Currently, the situation remains under control, but if it should happen, I can tell you that we are ready and that we will make sure it doesn't become a way of the virus to spread. So I repeat our 3 priorities. Don't go out unless it's necessary. If you do go out, keep your distances. And when you come back home, wash your hands. That's how we will save lives. Thank you.
Nous allons maintenant passer à la période de questions qui...
We will now go to the question period to journalists, starting today with Tommy Chouinard of La Presse.
Bonjour. D'abord, ma question pour...
My question is for the Minister of Health, Ms. Danielle McCann. I would like to know, where are we at exactly on the reserves of propofol and other essential medications in hospital settings for intensive care? Because there are people who are directly involved in the hospitals who are saying that these reserves are limited, that we might only have a week's worth, but we don't know where we're at. So where are we at? What I can tell you is that, in fact, we have to be very rigorous in the use of this medication, including propofol, and we are looking at possible substitutions, even old medications that we used to use in the past, to be able to help out. So there's a lot of work that is being done right now at this level. We have also decided, as far as the procurement of medication is concerned, and this is generally speaking, we've decided to centralize it within the ministry. We did that, as you know, for the protective equipment. It used to be the establishments that would procure directly what they needed with the suppliers. We, of course, in an emergency situation, that is what we have to do in order to really have as much rigor as possible, but also as much equity as possible. And we're doing the same thing now for the medication. So the work is being done right now, and we will be studying the possibility of using substitute medicine to replace, for example, propofol. Must I understand, therefore, that there's no specific numbers on the state of reserves? I can't give it to you today because, of course, we are doing that work right now, and we'll be able to, of course, in the future, give you more details on that and on the delay. But as I told you, we are examining other medications right now, so that could give us, of course, a lot more time ahead of us. And we're also looking at the possibility with our suppliers. We have not finished our work on that, so when we have a better idea, we'll be able to get back to you on that, because there's probably other possibilities with our suppliers as well. Dr. Arruda, who are the people who have died? Well, there's been 14 new deaths. They're all in the age category that we told you previously, and they're distributed throughout Quebec. And if you allow me, I would have a question that was asked me. I would perhaps have one more thing to say today. With the analysis, the daily analysis that we make with the public health regionally, you know that we had identified hot spots. Now there is community transmission that is being installed pretty much all over Quebec, particularly, I would say, the most populous cities, in such a way that today I'm announcing that we are recommending to consider all of Quebec as having community transmission. What this means is that right now there are still people that could be introducing it through traveling, but the main factor of acquisition of the disease is community transmission. Of course, there are zones, and it doesn't mean that we're going to be removing the roadblocks to protect those areas that don't have very many people that are affected. But right now, we consider that a person who has symptoms that are compatible with the coronavirus are potentially people who have that disease. So we're going to ask those people when they go to the hospital, even if they haven't traveled, even if they don't come from a hotspot, if they have a respiratory syndrome, we ask them to please wear a mask, and the healthcare workers will also be wearing a mask while treating those people. So that has more of an implication for the level of management of individuals that come to the healthcare for consultation. And that shows us also the importance of practicing measures of social distancing that we've already reiterated and repeated to you. That decision, clearly, that there's differences in dynamics in between regions. There are subsectors, others where it's more advanced. But right now we're at a stage where rather, than adding one area every day or subsections, we consider that it is time to say that it is community transmission that is sustained in some places, less sustained in others, but regardless, we're taking those measures. I wish to tell you that it is excessively important to not loosen our efforts. All the efforts that we have made up until now, and which are being fruitful, we cannot allow them to be annihilated if we loosen up what we're doing right now. We have to apply the guidelines and the measures. The people in the healthcare and those who are giving essential services are going to have to protect themselves a bit more. So that is what the guideline is. It is especially to reinforce, and because of the epidemiological situation, that's where we're at. Where we were after the March break or the spring break, it was mainly travelers, but it shows that right now the rate through travelers is decreasing. Of course, those people still have to remain quarantined, but we have to consider anybody that you don't know, and it's not to create a climate of suspicion, but anybody can be a possible vector. So don't take any chances, and I would ask you to please respect respiratory etiquette, to do the guidelines, the sanitary measures, and if you have any symptoms, don't lie. Please don't conceal anything. There are people who, for whatever reason, they want to go someplace or they want to enter such and such an establishment. If you have symptoms that are compatible with a cold or a flu, if you have a cough, if you have fever, it's very important to warn anybody who is going to be seeing you, because first, if it's a healthcare worker, it's to treat you, and second, it's to not contaminate our staff, and we end up with problems with staff shortage. There are people who lied for all sorts of reasons, who were positive to COVID-19, who went to hospital settings for whatever reason, and they lied. I would like to insist on the fact that it is very important. It is only together that we can win this fight. Yes, it's lengthy. Yes, it's difficult. Everybody is a little bit tired of the situation, I would say, but I believe that we're getting to this new phase and we're going to win if everybody puts the effort. Dr. Arruda, you announced today 6,997 cases, 896 more than yesterday. That's a huge increase. Just so that people understand well, with the message of prudence that you have given, what is the age group that is mainly being affected? Is it mainly men, women? Because yes, there are those who need emergency care. We're talking more about the elderly, but as far as the contamination itself, what is the portrait that you could give us today? Well, listen, if you allow me, I'm just going to look at my numbers. We have to be making a difference between the disease and this whole die of it. Most people, even above 80%, and in Quebec it's even more than that, are going to get ill, are going to be able to remain home. They won't necessarily need specific care. They're going to go through a bit of a rough time, but then they'll get better. So as far as the breakdown through the age groups, so there are, it's mainly young adults in terms 40 to 49 years of age. But as far as the deaths are concerned and hospitalizations, that is where we realize that there's a shift towards older people. So that is generally speaking. You can see on the site of the National Institute of Public Health the details, the breakdown in percentage. But, the people who are dying right now of COVID-19 are particularly people above 70 years of age, and particularly between 80 and 89 years of age. and also older than 90. There's a few cases. There was one case of a death, as I said, somebody who was between 30 and 39 years of age, a couple of other cases between 50 and 59 years of age, but it truly is a disease that kills the elderly, people with chronic diseases, for the time being in Quebec, and that is a profile that we're expecting to have, and that is why we put so much emphasis on the control of non-exposure of the elderly that are grouped in residential home for the elderly. Madam Premier, have we gone through another superior stage, so there's no longer any region that is no longer at risk? You have asked people to tell the truth, especially to police officers. In Saint-Jean-sur-Richelieu, the city has decided to apply fines, $200, $500, and $1,000. The Sûreté du Québec and other police forces, should they do the same thing to finish, with warnings? Well, we have already been giving tickets. There's reports that have been, general offense reports that are handed out by the different police forces when they see that, in fact, there are people who are still not complying with the guidelines, particularly through gatherings or also stores that are still open and should not be open. The situation that you're talking to me about in Saint-Jean-sur-Richelieu, I'm aware of it. We're still checking that over because it's very recent that the situation was broadcast in the media. But with what I checked before coming to speak with you today, it would seem, in fact, that they have set up their own municipal rules and their own tools through municipal rules to be able to act. And therefore, if it is what I think it is, and of course I still have to check some more, I think that it shows how serious the situation is. A city that gives itself extra tools to contain the spread of the virus, and in order to have more serious consequences against the people who are not following, it shows how serious it is. And all municipalities, all the regions, all the citizens, everyone right now has to take every means possible to be able to ensure that the rules are respected. Saint-Jean-sur-Richelieu has chosen that pathway, and under reserve of what I will be checking, I think it's a good idea. It's already been 12 days that we put Quebec on pause, but the number of daily cases continues increasing. So it's as of the 23rd of March. Are the measures giving the results that were expected? And the numbers, do they make you think that we're going to have to prolong the pause of non-essential activities? As far as the question of the measures, are they efficient? Yes, I can tell you right away that we even measured the question of social distancing in Quebec. It's the place where people apply it the most, so people are applying it. That's the first thing. As far as the efficiency, of course, we have a lot of cases. We're testing a lot, quite a lot. And what's important to me when I look at the rate of hospitalizations and the rate of deaths, I can tell you that if we compare ourselves, we don't even have 15% of hospitalization right now. We're way below that. We have fewer deaths. So the reliable indicators for the comparisons I would tell you right now show that we have an effect, because if we were like elsewhere, we would have a 15% rate. But it's early, and I'm not telling you that we're halfway. I have no idea where we are at. When we get to the peak, I hope that we'll have, gone above the halfway mark, and we'll start going back down. So, but I can't tell you. But are we flattening the curve? Well, I'm going to wait a bit longer to see what it looks like. I find, however, that things are encouraging. And if I look at the things that are recommended, I would tell you from the experiences everywhere, except, for sealing the doors to prevent people from going out of their homes like it's been done in certain countries, I think that Quebec is in a good position and made the right decisions at the right moment. But life being what it is, I am not an astrologist. I could make scenarios, but right now I feel that we have things in control. But we have had a lot of interventions, a lot of things to free up the system to allow it to continue. And also, it's so important to protect our human resources, because beds are one thing, ventilators are one thing, materials are one thing. But we have to have a health system with people in essential positions, police officers as well, the ones that transport the food, because if we don't have that anymore, we'll have problems and we have to protect those people. So to protect those people, we have to decrease the risk of spread by having a good kind of behavior. But I'm proud to be here in Quebec, and we'll see later how things unfold. And there are very pertinent questions that you're asking, and I'd love to be able to give you an answer, but I'm forced to say, as a scientist, I don't know. But right now, we have things under our control. There are zones of fragility, like everywhere in the world, relating to certain materials, etc. But right now, we have control. And don't forget, if you don't catch it, you don't need treatment. And on that, what I can tell you from the point of view of the health network, and the question was raised yesterday about situations that we would qualify as being semi-urgent. I have a lot of empathy for those people who have certain problems, particularly the cancer cases who are waiting for certain interventions. Of course, the situation right now allows us to reopen a little bit more. The situation as far as the N95 masks has improved somewhat, because that is what was, stopping us as well. The medication I talked about, we had to be very rigorous. So next week we'll be able to open up a few days for interventions that are semi-urgent. For example, in oncology, everything having to do with cancers. And there's a lot of work being done right now in hospitals by clinical committees, by very rigorous evaluations. And I also wish to tell you that this is new with this crisis. Specialist doctors and their teams are calling patients. And I invite people who are anxious, who have fears for their health in those particular situations, to call their doctors. They will answer you. And what is important in these situations is to communicate in a sustained manner. And in the next few days, some of those interventions will be done. So that is thanks to the efforts of the population as well, because that equipment was not needed for other situations of COVID-19. So it's thanks to those efforts that our health system is able to go a bit further in these semi-urgent situations. I was speaking of halfway for the pause that you decreed, Dr. Arruda, so the stopping of non-essential economic activities. Are you considering prolonging the stoppage of non-essential economic activities? And perhaps also a small comment. Must we expect a very difficult week next week in this crisis? As far as the pause is concerned, a lot of elements have to be taken into consideration, and that is a government decision that will take economic decisions and others. What I can tell you is that if we want to prolong the pause or not, I can be asked questions on what the conditions are so that we don't lose what we've acquired so far. It's clear, it's pretty clear that we're not going to wait the end of everything to say we're starting over again and we continue with our lives, because otherwise that would be insupportable. But what will be the mechanisms that we'll set up? Are we going to still be able to encourage working from home? There's a lot of analysis going on. And I would like to take this advantage. Madam Premier thanked the children. Or Deputy Premier, I would like to thank the people from the Quebec Society, all those who are helping others stay home, those who go distract them, the artists making beautiful music, who are inventing songs with the coronavirus. And actually, I should say COVID-19. You see that I've been in there since the 7th of January without stopping. And I would like to tell you, any gesture that we pose, while respecting the guidelines, but also in supporting others, in helping them maintain theirs, is a gesture of love. I want to say that. And I'm feeling that great solidarity in Quebec. I have so much towards myself, even too much. Give it out to people around you, people who make food and stuff like that. I'm forgetting, all those people taking care of everyone. To me, it shows me that we are a society that can fight this. And to get out of this, with a lot of growth. I'm very proud, very, very proud of our society. Now, to your other question, it's going to be an important week. Is it going to be the most difficult? Well, it's going to give us more information, because as we go forward, we'll have more details on what we think will happen. I would love to be able to know what's going to happen next week. I'd love to be already next Saturday to give you the scenarios that you'd like to have. But let's say that it's not going to, fall back down from one day to the next. And that's why we have to keep going. We've put too many efforts into all of this to stop now. Mr. Arruda, I've already asked you this question earlier this week on wearing masks in the community. The CDC in the United States now recommends that the Académie Française de Médecine also does recommend that the public at large wear masks, while mentioning that they should not be masks that are to be worn by medical staff. But we're talking here, for example, about masks made of fabric or scarves. Do you maintain the opinion that you had earlier this week, where in your opinion it is time that in the general population we start covering our faces to avoid sending particles on other people who are not infected? Well, I give my advice using evidence, and I think my experts have looked at all of this, but if you'll allow me, in the present context, what I can tell you is that our masks, the procedural masks, must be reserved, I would tell you, to those people who are going to be giving care and to essential workers that are going to be in contact with people less than 2 meters away to give them care. So in the present context, that is the main priority. And those masks, used in a context that is controlled in the healthcare sector, that could even be worn differently. Perhaps we'll keep the masks longer. There's notices that will appear with the perspective of the present healthcare system, amongst others because we're in community transmission. Now, masks in a community setting. What I say is I still consider that this cannot replace just washing your hands. But in fact, wearing a mask or a piece of fabric to avoid sending droplets, it's the same as when you cough into your elbow. So it could have that effect. But what I don't want it to do is give the impression that because I'm wearing a mask, I'm being protected. Science, with the generalization of mask wearing, either in the community for prevention or others, will give us the answers as such. But in the present context, I can't prevent people from making themselves a mask, especially if they have a symptom and they don't want to contaminate others. That's very good. But be careful with accumulation. If it becomes humid, if you handle it badly, you remove it, and you contaminate all sorts of things around, it's almost as if you had taken your elbow and started putting it all over the place and rubbing it on other places. So even the CDC recognized that this is protection that is perhaps 30% of less protection. And you have to understand that it depends on the fabric. It depends on how it's adjusted. There's all sorts of factors. I'm not telling you it's dangerous. I'm just saying that for procedural masks that we have, we want to reserve them for this, and we'll see what experts will recommend as far as the other ones are concerned. We'll follow it very closely. And as I was telling you, if it's going to be added for symptomatic people, and if ever you wear it, don't forget everything else, which is really important, and that is hygiene. Don't think that the mask will protect you.
Bonjour.
Hello. We base ourselves a lot on the police officer's judgment right now to apply the guidelines, whether it be on the field, to ban and control displacements between regions. But what we're told is that it creates certain worries, even frustrations. For example, I'll give you two. There are people who are asked to go back at a control point, whereas they wanted to bring food to an elderly person in a region, a specific region, for example, in the Laurentians, to be more specific. In the Outaouais, there was a person who says that they received a ticket of $108 because they had left their child in the car to go grocery store, whereas we asked for social distancing and the person was alone taking care of their child, which makes it that we should ask the question whether we shouldn't have clearer guidelines for police officers in the field rather than just base ourselves on their judgment. Yes, thank you. You are referring to the guidelines to the police officers, and of course, generally speaking, there are no guidelines. I'm not the one who gives those specific guidelines to a police force. Those police forces are responsible themselves for the application of laws and guidelines that public health has set up. So there will always be a discretionary part, a judgment, an interpretation. However, we are in permanent communication with all our police forces. And yesterday I participated in one of these conferences, what we call the police liaison structure. So there's a lot of information, the exchange of good practices, of specific cases like the ones that you've just spoke about. But we have to understand that we are in a context where we had to set up emergency measures, exceptional measures. We did so very quickly. So is everything perfect? Certainly not. Just like anywhere else. Could adjustments be made? Of course, we're in continuous improvement mode, in this sector as in others. But generally speaking, things are working well, the roadblocks, etc. The objective, don't ever forget it. The objective is to save lives and to avoid non-essential moving around. As far as the guidelines are concerned, and the best way for a citizen to not expose themselves to cases that become problematic or confused or don't quite know whether they'll be able to get through or not, is to remain at home unless you really have a really essential reason. Because yes, we're closing down areas one after the other, but the general guideline is stay home if you don't have an essential reason to leave the house, whether it be, to stay in the same region or change regions. So if you have any doubt, abstain from going out. And in those particular cases, as I said, there's always a part of judgment and appreciation of a specific situation on the part of police officers. And cases like that, there's going to be a lot because there's all sorts of situations, especially as we add more roadblocks. But generally speaking, our police officers work well. We want to protect our population. We want to protect our communities. So the message that I want to send to all those who are thinking of going from one region to another, the regions that are right now closed, well, stay home. Or perhaps evaluate another solution. I just want to understand then, in this case, when somebody brings food to, for example, an elderly family person, it depends on the police officer's judgment to see whether they can go through. Yes, it is the police officers who will appreciate the thing, but you have to look at the essential aspect of things. Of course, situations vary. If the person receiving that food can find somebody else, a friend, a service, a local organization, there are a lot of community organizations that offer these kinds of services, whether they be Meals on Wheels or different companies, that bring food to people's homes who are 70 and over. If they can also do home delivery, well, it's better to opt for those solutions which avoid moving between cases. But in a humanitarian case, because what's essential? It's three things: services and companies that are considered essential, so food and all that, health services, and humanitarian. So the humanitarian aspect has that criteria, and that, of course, is up to interpretation. So somebody who's alone, who has no family members, who have no grocery store close by, who has no delivery services, that has all sorts of elements that make it that they have no means of getting food other than their family, well, this can be explained to the police officers, and the police will be able to judge. One of the ideas that I can give, and I'm not substituting myself to police officers, but if a person just wants to bring food to a loved one, perhaps make sure that the food is already in the car and to show that you really are bringing food to somebody. And that's also good for people going to work. If you can have a letter from your employer, a document that shows that you're going there for professional reasons that are considered essential, it helps our police officers because they do their best. But there's nothing perfect. I said it earlier on. Sometimes they have to make a decision that is not always easy. We don't always have all the information to be able to make those kinds of decisions. But if we say, can we have general guidelines or standardized ones, we can give all the guidelines in the world, but there's always going to be some up to interpretation and judgment.
Vous y avez répondu, Mme McCann, partiellement tout à l'heure. Elle se demande, est-ce que toutes les chirurgies...
Are all surgeries in urgent cases of cancers, are they being effectuated or are they also being postponed to non-determined dates? Some readers are wondering if it's acceptable to have urgent cancer cases wait in order to prioritize care for a respiratory virus. No, the urgent cases are being treated. That's clear. All the urgent cancer cases and any other case is being treated. What I was talking about are semi-urgent cases where you can have more time, 4 to 6 weeks or 8 weeks, where you can postpone the procedure. What we're saying today is that taking into account the situation where we're at, that we have improved our situation with the N95 masks, in the next few days, next week, we'll be able to have a few semi-urgent cases, and I think that this, of course, will be very important. But all urgent cases, and I want to repeat it, are done. It's never, ever, ever stopped. Of course, we are taking the necessary precautions, but if you'll allow me, I would like to take this opportunity to talk to you quickly about designated evaluation centers that have been set up since the beginning of the week. We haven't had the opportunity to talk about it in the press conference. There was a press release sent because, yes, there's those cases that must be seen in hospital centers. But people, when we're talking about 6,997 people who have been diagnosed with COVID-19, those people also need care. Some of them, even most of them, in the more moderate cases. So what I wish to tell you today is that, as was said in the press release, though if those people can communicate with the 1877 number, and we'll direct them, we'll make an evaluation with them when they have symptoms, of course, and we will direct them, if needed, towards those evaluation clinics that are really medical clinics that have been transformed in evaluation clinics for COVID-19. So what we're doing in every region in Quebec, because we have 93 of these clinics, is that we wish to concentrate in certain clinics the arrival of people who have COVID-19 to avoid them seeing other patients who will continue going to the general medical clinic. So that is another measure of social distancing and of protection for the population, but also a measure to give the required care to those people who would need it physically. Because there's, of course, all doctors and teams that are working on the phone and in teleconsultation right now in the health network. We will not be going to English questions.
Bonjour tout le monde. Dr. Arruda, 14 new deaths today, 75 deaths total. Can you please give a breakdown of the age groups that are affected by that?
Yes, in fact, it's what we suspected, and it's still the same type of distribution. Most of the cases of dying from coronavirus or COVID-19 are over 70 years old. I would say most concentrated on between 18 and 89. There is cases of 90 years old. Only one under the 45, 55, 60, and only one which was between 30, 39. So it's a case that the people die when they are very older and also with medical other conditions.
Madame McCann, the Jewish General Hospital in Montreal is banning all guests from birth and postpartum. Is the Quebec government planning to reverse that decision, or is that something you support?
Well, what we have to say about that is that it's very unfortunate what happened in the birthing section of the Jewish General Hospital. Unfortunately, some conjoint, a partner of a woman who was about to give birth, was infected with COVID-19, had symptoms. And that is really, really something that should not happen in a hospital anywhere. And I think there was a lot of preoccupations because that person could have infected other people, you can imagine. So the hospital decided to stop the accompaniment of a person for the birthing. In other hospitals, it's still possible. But I want to make sure that the population understands. If you have any symptoms, be it of influenza or COVID-19, if you don't know, and if on the top of that, if you are diagnosed with COVID-19, you don't go out. You stay home, and you protect everybody. So it's the same if your wife or your partner is about to give birth, and maybe another person can go, if it's not the husband, can go and accompany the person who's about to give birth. So this is very important to protect our health workers and to protect the population. So this has to be completely followed.
Really quickly, are we okay for medical protective equipment now? You said the situation hasn't improved for N95 masks?
N95 has improved a bit. But for the rest, we're still at 8 days, and we're making a lot of efforts, and each day we're getting some supply. So we're keeping the rhythm.
Raquel Fletcher from Global News had the same question about the Jewish hospital. To be clear, do you support the decision of the Jewish hospital on this issue?
We can understand their decision because it was a very difficult episode. And as I said, other hospitals in Quebec in general, people can accompany the woman who's going to give birth. But I think the Jewish General was completely taken aback, very concerned about this situation, and that's why they took that decision.
Question from Phil Autier from Montreal Gazette for Mrs. Guilbault. Can you tell us how many SQ and Montreal police officers have tested positive to COVID-19, and how many are there in isolation? Has this affected the force's ability to work?
I don't have the new numbers for today, but there are some cases confirmed, as well as people who are isolated in our police forces throughout Quebec. They are not exception from the whole society. They are exposed as well. But what I can assure people, especially those policemen and policewomen who work out there, is that we do everything in our power to protect them. We are fully aware of the fact that as well as our guardians in the healthcare system, they are in the front line protecting us every day from the virus. So we have to protect them as we do for other essential workers. So we, as I said earlier, are in constant communication with all of our police forces to make sure that they work in the safest condition as possible.
Second question from Raquel Fletcher from Global News. With Passover and Easter approaching, what do you say to Quebecers who might be tempted to cheat or forego some social distancing measures and celebrate? The question would be to maybe Mr. Arruda.
In fact, I know it's difficult. There is people who that's their birthday today and they won't have any party about this. I think that we must postpone those things, any kind of people getting together. And I will tell you, it's happening with weddings, with funerals, with even people playing in a sports room and everything. So it's not the time. And let's perhaps have a bigger gift or a better party later, but I think that's not the time. I'm really sorry about this. And it's not because of any religion or anything. It's just because it's not the time to gathering. Because to protect you and protect others, especially protect others, because if there is a transmission during this, that one of those persons can infect another one, that can infect another one, and can kill somebody else.
And as a compliment, maybe all kinds of gatherings are forbidden. And the rules apply to everyone. So there is no wondering whether you can or not gather with someone else unless you have specific reasons like essential workers and things like that. But even in those essential services, employees and people have to keep their distance from one another unless it's really not possible. So all gatherings are forbidden and the rules apply to everyone. So please comply and keep in mind that we do all that to save lives.
A question from CTV now. What is your reaction to the CDC's recommendation that the general public should now be wearing face masks during the COVID-19 pandemic? Question for Mr. Arruda.
In fact, we are looking at all the evidence based on science to that. I think that's an emerging approach. Even CDC days ago say that those masks are not protective at all. As I was telling, in Quebec, the priority is to keep the masks for the healthcare system and the essential services. That means if you must be under 2 meters to treat a person, you must wear a mask and everything. The mask will be perhaps the one made in tissue or something else. It would be like if I cough in my shoulder. No, it's not the shoulder. It's the elbow. In the elbow. And so, but if there is a concentration of microbes over there and you take it away, you contaminate your hands, you put your hands everywhere, and washing is more important. But it could be okay if someone don't want to sneeze over and use it. But if you think that you're using it for protecting yourself to get contaminated, the mask, you will touch things with your hands. You will have to look at the mask and then contaminate yourself. So I understand that. We will look at this as the literature is going to prove, but don't think that the mask is the solution. Hand washing, having good hygiene is the best thing to do.
And the last question from Philippe Autier, Montreal Gazette. Mrs. McCann, can you bring us up to date on Quebec's efforts to produce its own protective medical supplies, including N95 masks?
Well, we're working very hard. The whole government actually is working very hard so that we become autonomous in producing those equipment. Of course, at this period, we need to get a lot of supply for the next few weeks, but we would like to become autonomous as fast as possible. It's a priority of our Prime Minister, and we are in touch with many enterprises, and we're working very, very fast to really put together all the chain of production so we can become autonomous as fast as possible. This is the highest priority in our government.
Thank you very much. Merci beaucoup à tous. Ceci met fin.
Thank you, everyone. This puts an end to the press conference.